Good afternoon. We're here today with Wendy Kroll. Wendy is the Business Development Specialist at Heartland Healthcare Centers. Thanks for being with us today.
You're welcome. My pleasure.
Let's just start out and tell me a little bit about Heartland Health.
Okay, Heartland Healthcare Centers is actually part of a parent company called HCR ManorCare. And HCR was started in the 80s, and then they merged with ManorCare in the 90s. And under that parent company are the Heartland Healthcare Centers that are here in West Michigan. There's Heartland Home Care and Heartland Hospice. There's Arden Courts facilities, which provide assisted living. It's a pretty big company. We employ almost 60,000 employees, and that's across 32 states. So we're not totally nationwide, but there are many, many places in the country, many of which are centered in here in Michigan. In West Michigan specifically, we have 3 in the Grand Rapids cluster area, and that's what I cover. That would be 2 in Grand Rapids, 1 in Wyoming, 1 in Muskegon, 1 in Whitehall. There's a facility in Holland, Battle Creek, Kalamazoo, 3 Rivers, and then Ionia, and then the whole east side of the state. So we do have quite a few skilled nursing facilities here in Michigan, and my role with the company is specifically to talk about the 3 skilled nursing facilities in the Grand Rapids area. So that's how all my answers are going to be tailored today.
So skilled nursing, for people in the industry, certainly we know what skilled nursing is, but for just the everyday person, what is a skilled nursing facility?
We provide 2 types of service. We provide long-term care, and we provide short-term rehabilitation, and they're very, very different. Long-term care is what you think of when you think of nursing home. Skilled nursing is really different, because if you look at hospitals in the past 10 or plus years, their length of stay, meaning how long a patient is in the hospital, has actually decreased because of Medicare cuts and other things. So skilled nursing facilities have had to expand their role to basically be a replacement for the hospital. So years ago, when someone would have an issue that would put them in the hospital, they'd stay there for 10, 15 days. That's no longer the case. Their discharge planners are discharging patients home or to other places in a shorter amount of time, and these people aren't any better. They're just needing to go somewhere else. So doctors still use the term nursing homes to encompass long-term care and skilled nursing, and they're two very, very different things. So our skilled nursing is what I refer to when I think of a rehabilitation center or a replacement for a hospital, meaning we are going to care for you after an episode that has put you in the hospital, and then we're going to rehab you and get you back home.
So describe maybe the typical patient or the typical person that's going to come to Heartland here in Grand Rapids.
Okay, that would be someone, we typically get higher acuity patients, meaning medically complex issues. So complicated wounds, someone that's had a stroke. We take bariatric patients, orthopedic conditions, cardiac care, people with some pretty complicated medical issues, respiratory, trachs, things like that.
So who then, when those patients come to you, what kind of staff is there to help them through this process of, getting better and being able to maybe go home at some point?
We have a plethora of medical staff. This will vary based on the facility, but every facility has physician coverage. The Heartland on the East Beltline has 5 following physicians. It's a pretty big facility. Some of them don't have as many, but the coverage schedule is what you're looking at. So you want as much physician coverage as possible. And that would be a physician. It could be a physician's assistant. We have nurse practitioners on staff. We have a respiratory therapist. We have registered dietitians. We have speech therapists, physical therapists, occupational therapists, nurse consultants, registered nurses, some licensed practical nurses, certified nursing assistants. All of our nursing aid care is provided by people who are certified through the state of Michigan. We have lots of different specialists involved in a patient's care depending on what their care needs are.
Okay. So essentially, you've got the whole spectrum of providers there for whatever kinds of rehab they need when they come in. So maybe without using actual names, you could tell us about maybe one of the people who have come to Heartland and the staff there has gone above and beyond what would be expected.
Okay, well, there's a couple of people that come to mind, and I think our staff does a really good job of, like, lots of people when they leave say, oh, this was so great, but really there's not a whole lot that we did that we would consider above and beyond, because much of what we do we just consider part of our jobs. But I had a patient come to us that had been at a different skilled nursing facility first, and I think these people just don't know how to make that kind of a decision, and this is what he said to me. He said, they had a beautiful facility and $1,000 TV hanging on the wall, but their therapists couldn't figure out how to turn on my CPM machine. And to me, that just says how you should choose based on a clinical team. But again, we didn't really do anything for him that was above and beyond. He just thought it was great compared to someone else. But there is a patient that comes to mind when I think of above and beyond care. And I did ask her permission to tell this story, and she was like, oh, absolutely. She came to us and was at our facility for over a year. She thought she was going to live there for long-term care. She had a debility that made it so that she didn't feel comfortable living alone, couldn't get around in her house very well, and she was quite young. And we had cared for her. She had a therapy dog when she was at home, and couldn't keep that to live with her at the facility. So one of our therapists actually took that dog in and brought it home with her every single night, brought it to work with her every single day so the dog could spend time with this patient in our facility. And, she was totally content there. So I think that's pretty above and beyond. But the other piece to the story is that we sometime later had another patient come into us for short-term rehab. And she was sort of in a similar situation. Younger lady, had an episode which put her in the hospital, and didn't feel comfortable going back home. But the two ladies hit it off at our facility, and it was our social worker that had, in conjunction with the therapist, they came up with this idea, like, you guys should discharge together. So between the two of them, our social worker was able to piece together enough resources for the two ladies to be able to discharge together as roommates in the community. So they're not at our center anymore and couldn't be happier. So
oh my gosh, what a great story.
Yeah.
That is a great story.
Our team does a good job of thinking outside the box, and that's the one thing that I like about our center and our staff that we have.
Right. Well, you brought up something that made me think, if someone goes into a hospital and, has a procedure or something where they're not able to go home and they are going to have to go somewhere to rehab, how do they make that decision? How could they wind up, for example, at Heartland?
That is a good question. There's a couple of different ways. Sometimes for our long-term care patients, it's usually families that are thinking, mom's not doing well at home, and then they can come in and tour, and that's, a process in and of itself. And things you should look for would be different in that regard. But if you have a planned surgery, some people will come and tour different places ahead of time if they know that they might not be able to go directly home. They'll come tour different places ahead of time and then have a place picked out. And really that's the best way to do it, I think, because when you're in the hospital, you're depending on family to make that decision for you, and it creates a lot of stress if you don't know what kind of environment you're going to be going to from the hospital. So we have quite a few patients that will call ahead, set up a tour, come in, pick it out. We have everything ready to go for them. I'll even save a room. And then they know exactly what's going to happen. But if you have a stroke or some other thing that ends you up in the hospital, it's hard to make that kind of a decision. And the hospital staff, depending on the hospital, typically just give you a list. Here are all the facilities in Grand Rapids. Good luck, And some of them provide more guidance than others, but what we're finding is that when these patients come into tour, their families come into tour, they have no idea what questions to ask. And I had alluded earlier to the fact that choosing a facility based on location or amenities is important if you're going to live there for long-term care, but what I would encourage is to shift your focus to the clinical team, the therapy outcomes. What can you do for me? As
To get you
opposed
back
to,
home.
yes,
Right.
and people just don't know what kind of questions to ask. So we actually have a brochure that has questions on it that tell people what to ask. It doesn't say come to Heartland. It says ask these questions when you go out and tour multiple places. So it'll say like, how many patients have you treated with this condition in the past year? What is your success rate? Those are the kinds of things we think people should be asking, and they don't.
Right.
They
I don't
come
know
in-
that I would have thought of any of those to ask, but great questions.
No, I mean, and I think, again, it goes back to that whole stereotype of a nursing home. And what do you think of when you think of a nursing home?
Not a lot of good things.
Right. There's a lot of things that come to mind. And,
Right.
and I think people come and they think cleanliness and that is certainly important. But you wouldn't choose a doctor's office the same way. You would expect that to be clean. So people will come in and tour and they'll be like, yeah, it smells good in here. This is the place. And I'm like, we didn't even talk about, didn't you say your dad had a stroke? Shouldn't we cover like the outcomes or what we can do? So that's where I think people should expect the cleanliness. And then on top of that, ask about, I mean, you wouldn't go to Cleveland Clinic. You wouldn't go to U of M. Lobby smells good. Let's go,
Right.
So that's what we try to encourage people, and we try to give them the tools to do that.
And so when someone is going to get discharged from the hospital for a rehab, or they're going to have to go to a facility, they do have a choice. They can pick where they want to go.
Yes,
Okay.
and that is the number one thing I would have someone remember is, I mean, it's not as fun as shopping for shoes, but it is important. It's a critical time in someone's life when you're choosing, and people just they aren't given a lot of time. I see it all the time where families will come in and they'll say, oh, I didn't know, I thought my dad was going to be able to go home, and now they're saying that he needs nursing home care, and people hear the word nursing home because the doctors still use that, interchangeably with skilled nursing, and their families are just all stressed out because they don't have time to make an educated decision. So, I mean, I guess if I could change anything, it would be don't just pick off of a list without seeing the facility and asking those kinds of questions. Yes, you have a choice. No matter what anyone tells you, you have a choice as to where you go. And you should make a decision based on what the right fit is for how someone can clinically handle what your needs are.
Well, and speaking of that, you get a list from the hospital, so certainly there are other options out there.
Mm-hmm.
What would make Heartland Healthcare Centers the choice?
Nursing and therapy. Our facilities have tracked therapy outcomes for years. We use the Functional Independence Measure Scale, or FIM scale, and that's the same scale that rehabilitation hospitals use. We try to benchmark our program against rehab hospitals. We are not an acute rehab hospital. I'm not saying that we're the same. We're not at all the same level of care as an acute rehab hospital, but we do benchmark our success against their programs. We try to make a therapy program individual for someone based on that. So we'll track how independently they can complete certain functions when they come in. We'll help them set realistic goals, and those can depend based on how long your insurance is going to cover you, how much support you have at home, that kind of thing. And then we'll measure where you are when you leave. So we know our program is the best because we've been tracking it for years and have the data to back that up. And then our nursing staff is the other thing. Our centers typically take these higher acuity patients, so that skill set is just kind of ingrained in them. And the level of training that's required to manage that kind of care is above and beyond the number of specialists that our company can afford to provide. Gives families the peace of mind that their loved ones are in good care.
Well, great. Well, before we conclude, Wendy, is there anything else that you would like our audience to know about Heartland Healthcare Centers?
Just that you have a choice as to where you go, And if you or your loved one or anyone that you know ends up in a hospital, take the time to make an educated decision and focus on what's right for you and your family. Ask questions about the clinical team and the rehab department.
Great. Wendy, thanks for being here. Wendy Kroll from Heartland Health Care Centers here in Grand Rapids, Michigan.
Thank you.